Honorable.
Thank you very much, Sanjay. Good afternoon, ladies and gentlemen. We gather here today to give you the updates with regards to the COVID-19 pandemic and how it unfolds in the Gambia. By way of recent updates, all 5 recent laboratory test results received from yesterday till today are all negative. Now, this includes the lab test for the first diagnosed COVID-19 case in the Gambia and the 3rd diagnosed COVID-19 case in the Gambia as well. Now, these tests have been negative. Now, as per the WHO guidelines, the 2 consecutive negative tests for each of these individuals is a confirmation of recovery. So, I repeat, the 1st and the 3rd COVID-19 cases in the Gambia are declared to have recovered from the disease, as confirmed by the 2 consecutive negative tests going by the guidelines. And these individuals have been discharged from the hospitals. However, we want to emphasize this does not give any room for complacency. This means we should still be as vigilant as possible. People recovering doesn't mean that we should take the disease lightly, because we know that the mortalities associated with the COVID-19 is increasing worldwide with increase in the case fatality rate. The country currently has only 1 active case, but as we all remember, cumulatively, we've had 4 positive cases, 4 confirmed cases. Currently, we have only 1 patient who is receiving care in the government treatment center. The other 2 have been discharged. In addition to that, 65 low-risk contacts, also known as contacts of contacts, were identified and followed up by our tracer teams. This brings the cumulative number of contacts traced to 233, and a total of 102 tests were conducted, both new and repeat. Since the beginning of the pandemic, all confirmed cases in the country were imported, and there is yet to be evidence of local transmission in this country. This gives us the opportunity to enhance our prevention strategies to make sure that we do not have local transmission in the country. So I think this is an opportunity for the entire country to work together to strengthen what we need to do so that we prevent local transmission, because local transmission is the main problem in most of these countries where they have a big challenge in dealing with the problem. Fortunately, as we speak in the Gambia, there is no evidence of local transmission. We thank the Almighty Allah. We therefore need to strengthen our efforts to work very hard, to follow the rules, to practice social distancing, to practice the techniques that have been taught to us, the hand washing techniques, the techniques in coughing, and all other activities that have been taught to all of us by now to prevent local transmission in the Gambia. Ladies and gentlemen, globally, we all know by now that over 850,000 cases were confirmed in over 200 countries and territories since the beginning of the pandemic. Of these, over 42,000 deaths occurred, giving a crude fatality rate of 4.9%. Now, we also realize that the fatality rate is increasing from 2.8% at some point to now 4.9%. That means globally, more and more people are dying of COVID-19, and that calls for concern. Senegal, our closest neighbor, has so far reported 175 cases, that's positive cases, and out of those, 40 of them recovered. The media briefing is to raise awareness, to give you the current situation of COVID-19 in the Gambia, but also to raise awareness, to reassure the people, the population, that government is doing all what we can do, together with the partners and together with all of you, to ensure that COVID-19 is contained in the Gambia. The public is once again urged to play its part by reporting any suspected cases through our toll-free number 1025, following the widely disseminated preventive measures and complying with the executive directives issued from the presidency. We will, at our end, continue to engage all media platforms in the dissemination of credible and timely information. It is our duty to obtain information from credible sources. The more we commit ourselves to this challenge, the better for everyone. Together, we can do a lot in the containment of COVID-19. So let's stay together as one nation and make sure that we fight against COVID-19. And inshallah, with the help of the Almighty Allah, COVID-19 will be contained in the Gambia. Once again, I thank you all for all your efforts, but the struggle continues. We should not relent. We should do whatever we can do. No room for complacency. Let's continue our hard work. Let's continue the hand washing. Let's continue the etiquettes of coughing. Let's continue staying indoors when we do not have any reason to be outdoors. Let's stop the close socialization. Let's stop the attire woos, because the attire woos, we realize, are very intimate groups where people get very close to each other and drink from the same glasses throughout the attire session. So we discourage that completely this period. These are uneasy times. These are uneasy times, unusual times, and they call for unusual responses. So we all have to adapt so that inshallah one day COVID-19 will be history, and then it would have left us all alive and healthy. Thank you very much.
Thank you very much, Honorable. The message is very clear. We need to continue working together. We need to collaborate. We also need to ensure that people practice hand washing at regular times with soap and water. And also to use our 1025 in case they realize that either them or a neighbor or a friend or a family member is experiencing coughing, difficulty in breathing, and as well as has high fever. You don't need to report to health facility, but just call the 1025. Very good message, Honorable, and very clear message. And we do hope the committee members also will continue to collaborate as they are doing, so that they also continue to send out messages and to keep us informed as to what is happening within their area. Thank you very much for that wonderful statement. I now allow the question and answer session to be facilitated by my colleague Sankano, the leader. Sankano, you're welcome to lead the talk, facilitate the question and answer session.
Thank you very much, Director of Health Promotion and Education, Mr. India. Thank you very much, Honorable Minister, for the reassuring words once again and the good news. Thank you, ladies and gentlemen of the media, for being with us through this battle. Just before allowing you to ask questions, just to elaborate on what Minister said about the attire. Coincidentally, the Gambia government will issue a press release through the government spokesperson elaborating areas of social life affected by their Emergency Powers Act. So attire booths, as the Minister mentioned, you have to observe, social distancing or physical distancing. According to the explanations we got from the Minister of Justice, there should not be more than 5 people together when brewing attire. Not more than 5 people whenever you are organizing attire booths. The other details will be in the next government press release, which will be out later tonight. On that note, I would like to invite 2 or 3 questions from the media corps. Gentleman from iAfrica.
Thank you very much. Like you mentioned, that 2 cases that the force and the cat have been discharged. Now, I want to ask, what sort of medical course was applied to ensure their recovery? That's the first question. The second one, we reported earlier that some government officials who came from outside on a mission, voluntarily went on self-voluntary quarantine. And some of them in another flight included some of the service chiefs and the female cops. So what is the situation about these people? Has the ministry been in touch with them in terms of monitoring? How are they doing about that?
Yeah, thank you very much. Of course, we know with the management of COVID-19, supportive therapy. You give them supportive treatment. That's what it is given to them. They were in the facility and were monitored and given supportive treatment. And in addition to that, they had the psychotherapist who was also giving them psychotherapy and so on and so forth. Of course, we all know at this juncture that there is no definitive treatment for COVID-19. So what they received was basically supportive treatment and continuous monitoring as and when to intervene if it were necessary. Fortunately, they didn't progress to those stages, and we thank the Almighty Allah for that. Now, with regards to the various people, security forces, security personnel who traveled, and you say the government, senior government officials, you realize that there were phases in the response to the COVID-19. At the initial phase, people were not being quarantined, I'm sure you know. What was happening was they were advised on self-isolation in their homes, and our people went there to check their temperature and so on and so forth, to monitor them consistently so that if they developed symptoms, they would have been picked up and then taken to the treatment centers. But as time went by, the issue had to be escalated depending on what was happening elsewhere in the world and depending on what was also happening locally. So it had to be escalated, and some of them had to be quarantined at that juncture. So those who came before the escalation would have gone home and continued to do the self-monitoring or the self-isolation and monitoring by our people. Those who came at the time the quarantine was instituted went to the quarantine centers. So that is how they are being dealt with. Now, the service personnel that are in those facilities are there and are being treated just like any other person. So they are still over there. And the last time I went around and I saw some of them there are just as the other Gambians or non-Gambians who are there. So they're all getting very good treatment from our people, and they are also all being monitored very closely, health-wise.
Yes. Thank you very much, Honorable Minister. There are news going around that apart from the Medical Research Council, they do also conduct tests, especially they made a particular mention of the Serekunda General Hospital. So I want us to use this platform to make a clarification.
Kindly repeat that, you said?
That they also conduct COVID-19 tests at Serekunda General Hospital.
No, not as I know of now. What we are doing, you see, the MRC is a research institution. They've been known worldwide for conducting research. When it comes to medical research and doing certain tests, before the tests are simplified, quite a number of these diseases are tested in research institutes, even in the West. The governments, the universities, and so on and so forth collaborate with research institutes or research institutions that in many countries are even not owned by the governments. And they are used because all their work is mainly research-based. So usually they have an edge over governments in conducting research because that's all they do most of the time. So government collaborating with MRC is nothing new, and it is a good practice. In fact, before this started, the point for such tests would have been in Le Pasteur Institute in Senegal. And that one too, as I'm aware, is not owned solely by the Senegalese government, you see. So there is collaboration in this. The one in Accra, Ghana, Nagushi is also some form of collaboration. So researchers do collaborate, research institutions collaborate to look at, especially when it comes to new phenomena. However, what the government is doing, as I speak to you now, is to also strengthen our public health laboratory. The experts are there making the assessment, and we are going to strengthen our public health labs, our public health lab in Kotu, and we want to also strengthen the other labs so that this test can be decentralized. Because we pray against it, but just in case we need to do a lot more tests so that our facilities will be ready and being able to do those tests. That's what is going on now.
My question is, what should happen if a person who enters the Gambia showing no signs of the virus? Should he or she be let go home?
Yeah, so my answer to that is, you remember the phases we followed before. We said at some point if they came from hotspots, they would be quarantined. If they came from zones that were not considered to be hotspots, then if they didn't show signs or symptoms, or signs and symptoms, then they would be let home. Now, but the rules change as the disease evolves as the disease evolves. You realize that that's why now we close the airspace. We realize that that's why now we close the borders, so that no one comes in at all, because the number of hotspots have increased and the disease is widespread. Because the challenge is when you check the temperature could be normal, and the person is still harboring the virus. Because you remember that, there is an incubation period that varies, right? But we know from what is known now, it is pegged at a maximum of 14 days. So within those 14 days, that means there is still possibility for an infected person to show signs and symptoms. But what is also known is that even without showing signs and symptoms, the infected person could infect other people. So it is very important for us to know that it is not only the person who is coughing or sneezing or who has elevated temperature who can infect other people. Seemingly normal people could also infect other people. That's why it's very important for us to be very watchful and maintain the precautions, and we do the social distancing. I think it is very important. Yeah.
One last question.
The last one.
Yeah.
Do you see the need for sensitizing the public? If so, what are the measures you put in place for this?
Of course, there is, a big need to sensitize the public. It is a continuous process. We are doing it daily. In fact, I guess as we speak, we are sensitizing the public as we speak to you. So that is ongoing. People are up and about, talking to people, carrying posters, talking on the radio, on TV, using loudspeakers to talk to people. The health promotion team is doing that. The civil society members are doing that. Of course, the musicians themselves are doing that. There are a lot of Corona songs, isn't it? And they're doing very well. Even the kids now, a lot of the kids know about COVID19 and the routes of infection. And, I've seen kids not wanting to shake the hands of people because of the COVID-19. I've seen kids asking people to go wash their hands. So a lot of people know about it. But still, we need to go out there. We need to continue that. Our people are doing it. But we make sure that each and every person living in the Gambia knows what to do. And not just knowing what to do, but we practice what we know. That's very important. Yeah.
Thank you very much. The Director of Health Promotion is in charge of sensitization. He can tell you more, and then
Honorable is very, very right. What he's saying, certainly something is happening, and as communication is dynamic, we are now also now moving from sensitizing people to know the disease, but also to be aware of key things like social distancing, and as well as stigma and discrimination. So we know that is an issue that is also coming up. So as we are also moving with the communication, we also look at that. So we are moving on, and then as he said, he was also able to engage the National Assembly members across the country. And as I speak to you now, all the National Assembly members are in their various constituencies, and they're also trying to sensitize the public. And then there's also another youths are coming up. Every time we have youth groups, and we have songs, we have been having dramas, and these are things that are also helping us to raise awareness. So a lot of things are happening, and our plan is also to have a synchronized broadcasting, which will also start next week, because we've now finalized the arrangements, so that when anything we are doing here, the broadcast will be synchronized. We just connect with GRTS, everybody will just connect with GRTS, for example. So that's what we are also planning. And also, all what is also reading here will also be translated into local languages for better understanding. And you are seeing billboards and signboards across the country. So this is also one of these things that is his support. So I think what we need to do now, as he said, we just simply continue to do more, and then even having this daily press briefing is something that is also trying to raise awareness among the general public. Those who are around will know what is happening. Those who are outside the Gambia will know what is happening. It's also and people really appreciate this press briefing on a daily basis, because every day you will have a new information, and that new information goes to the public, and they appreciate it. So together we can also be able to raise awareness more and more. But this is a continuous process. Even after Corona, we're still going to continue the sensitization. Because we need to emphasize on certain behaviors. That is, for example, hand washing. This is something that's also very important. Certain behaviors like coughing in public. All those things are behaviors that we need to continue with, so that we can also be able to, yes.
Do you also think that this daily press briefing also strengthening, whereby we will be allowed to visit centers and also go on strikes on the borders to see what is really going on? It's very important, rather than every day doing the same thing, because other people are just saying that every day I'm there in a press conference. I'm in the money can help take a baby again. So do you also think that that is necessary?
This is something that myself and Honorable Minister have discussed and agreed upon. I mean, as he said, he's currently working on finances. We've already submitted a request for that one. We in fact call it media field visits. So which we're thinking of getting all the media house, and we're going to go with him, and we go from point A, from one point to the other. So we look at all the points of entry, we look at the isolation centers and health centers, we also look at the quarantine centers up country. this is the plan, and we already got it. We are now waiting for the resources to be available at our level, and then with this time, because we also want him to be part of us. So at least having the minister with us in the field also carries more weight and also give us that sort of because we can even do the press briefing.
I think the point is certainly informing the people as to what is happening is very, very important. And we think the people need to know what is happening, because everybody is concerned about the COVID-19. And I tell the answer or the comment to those who say the same thing is good. So if we announce negative cases, I think that's good for Gambia, isn't it? So we are happy that we announce more and more negative tests. Of course, if there are positive tests, we'll also have to announce them. But I think the people need to know what the situation is as we speak, because everybody is concerned, and so that's why it is warranted. Of course, the numbers, we have all spoken about the numbers, and I think this one is the journalists who do not really want to reduce the number of people who come here. But I think we look for innovative ways to get the message across to all of you, so that you do not all have to come here and crowd here. But I think you try your best to maintain the social distancing. I think that is equally important that we do so. And the journalists too, you have to practice even sanitizing your equipment as well, because equipment sometimes can be the source for infection, including your telephones, your microphones. I think they need to be wiped as well, because sometimes trivial things that we overlook could be the source of contamination. So we need to make sure that we practice it ourselves and clean our gadgets to the best of our ability. I think that's important. But whether it's positive news or negative news, I think the people need to know what is happening, and so that they know how to act accordingly. So it is very important. And today's news is very good. We are happy that 2 people have recovered. However, people should not take that to be that it is not a serious disease. It is a very serious disease, and we all need to pay attention to what we need to do to prevent being infected, and to prevent other people as well from being infected. Yeah, thank you very much.
Thank you very much.
Now, with regards to what happens at the border points, you know that the borders are closed now officially. Certainly, our team, they just from up country, yesterday, isn't it? Or the day before yesterday, they went and myself and the other people have been going all over the country to look at what is happening at our various facilities. But nonetheless, the journalists can also visit those places, even without us, to see what is happening. But when our teams are going, you can also join to see what is happening, so that improvements can be made, everywhere that we need to improve on. Yeah, thank you.
Thank you very much, Honorable Mr. Dr. Samate, for those wise words. As he said, 2 things are mentioned today: dynamism. You have a plan that will go into moderator, but you also have 3 investigative journalists to go and visit the borders, and then for yourself. Thank you very much for coming. On that note, I would like to end today's press briefing. See you tomorrow for dealing with more encouraging news for the Gambia. Thank you.